Hi, everybody out there in South Africa. This is Ken coming from Mauritius. Still in lockdown. We're still not able to do too much out here, but of course, like yourselves, it's slowly getting better and better and better in terms of what you can do and where you can go. One of the things that we thoroughly enjoyed when we started the lockdown is that you can still buy beer and wine here, and they've never stopped that. And those who want to smoke can smoke, but I know in South Africa, that's been quite an interesting process, hasn't it? So everybody that's survived lockdown up to now, well done. Not sure how you've done it. For us, it's a little bit more freedom because obviously it's not such a big island, and the police are obviously out where the population are. And we're on the east coast of Mauritius, which is a lot less populated. Okay, so there's my WhatsApp number. Would you please register on WhatsApp to just let me know that you're here and you can hear me and you're participating. I see John says, I'm here. Darren says, I'm here as well. Louise, she says, okay, done with this one. Michael's there, Renee is there, fantastic. The rest of you just log on, that'd be absolutely brilliant. Okay, tonight's or this afternoon session, now I say tonight because in Mauritius we are 2 hours ahead of everybody. It's already 6:15 over here, so Penny and I are sitting waiting for the meal that's been prepared for us. We've got family and my daughter and her boyfriend are here, and they're prepping a meal and I can smell it from the bottom. And Darren, as you know, there's a cold beer waiting in the fridge for me once we're finished. For those of you that are here for the very first time, and those of you that are going to be watching this video afterwards, because we'll obviously upload it onto YouTube, I'd just like to tell the story that Penny and I started INTRA-SAFE about 15 years ago with the primary objective of supplying training material to trainers who would then run their own training programs. And we started off with single individual programs, and it's grown and grown and grown and grown and grown. And as of next week, we're going to have about 25 programs. So it's jumped from 17 to 25, and we'll talk more about that. We have a program called the Affiliate Program, and we'll talk more about that. But two things that are really important is that these programs that we own and we obviously sell to our affiliates, they are SIOSH CPD accredited, and we as an organization are FP&M CETA accredited. And I know there are a number of other people that are watching at the moment that are also FP&M CETA accredited as well. So that's the range of training programs. I'm not going to belabor it and get into it, but given the fact that you go literally from the newest worker through to management and then all the health and safety teams in between, this is quite a range of programs that you can use to train up your people. Whether you're doing it for profit or you're doing it as a promotion or you're doing it as a public service, it's completely up to you. But these programs, half of them are unit standard aligned. Another almost 10 will come online that are unit standard aligned. And it's very exciting to say that we can offer either legal compliance training and or CETA accredited training as well. Just a quick one about CPD accreditation for SIOSH. If anybody is a SIOSH member that's watching these videos, you can let me know. And attesting to the fact that you've watched them all, I will issue a certificate of participation. And what you can then do is you can go onto the SIOSH website and you can actually claim your CPD points. Currently, for the COVID-19 program, we have one. We will be applying tomorrow or the next day for an additional CPD point for part 2. But there it is, it's 2 points that having just attended the webinars and watching these recordings that you can claim. The affiliate license program will provide a lot more information on that if you're interested in it, but essentially it's similar to a franchise, means that you get all the training material, you get the license to use the training material, we have a support system behind it, the programs are affordable to acquire, and so forth, and then of course it's up to you to market and sell. We deliver the programs via Dropbox, and this is just a simple example over here, with facilitator guide, learner guide, pocket booklets, and so forth, and certainly normally a comprehensive set of PowerPoints that go with it as well. Now, all of that training material you can then use, and when you acquire it, we do suggest that you go through this affiliate orientation process. I've sent the URL to everybody. If you want it again, just let me know, WhatsApp me, and I'll send it to you again. But basically, this is our own online academy. It's a very simple way. You don't register, or you don't log on at least, but you just do a WhatsApp registration, and then voila, you're on and you can watch it. If you have teams, Johannes, jou mense daaronder in die Kaap, you can freely share this information with them and then require that they go through the, I think it's about, gosh, almost 10 videos over there that they can go to. And it'll just allow them to understand how this process of ours works. Something that I am strongly a believer in is the fact that we have a free legal advice system that comes from SIOSH. And the SIOSH, the South African Institute of Occupational Health and Safety, they provide us with constant updates. And I strongly, strongly urge you to actually join them and get those updates from SIOSH. I get a lot of my information from them, or heads up, and they're very, very sharp. Sometimes they're faster than me in terms of getting the information out there. Okay, so from there, the next thing that I want to say is that we have two issues that we always talk about, and more so nowadays, because we've had a couple of instances where people have misappropriated our training material. We've sorted them out. We've sorted out the situation. We're friends with the people, but we own the copyright. And of course, you get the rights to use the training material, but not repurpose and resell the facilitator material. Then there is the second issue, which I mentioned, and this is an important one. We did a video on it a little while ago, or a webinar, talking about who may use the logos. Our logo, you may use, with our permission and our blessing. FP&M, CETA, and SIOSH logos, you may only use if you are accredited by them. Very important, very, very important. Okay, and then finally, we say to people, you can customize the training material, and you can add your own look and feel and your own colors and layouts and fonts and styles and photographs and videos and anything like that that you want to. And of course, when you get the training material, you can customize it in the sense that you're saying, I happen to be speaking to a group of supervisors. There is some stuff I don't want to talk to them about, and others that you can. And it's important to know that instead of deleting the PowerPoint slides in this pack, what you do is you just switch them on and off. And there is a very simple way of doing that, so you don't show them when you get to that stage. And then, of course, I want to just urge you to be as professional as possible. Natalie, my daughter, who's a social media specialist and practitioner, she talks about this a lot, because people have, she calls it back alley artwork. And it literally is going to the guy around the corner and swapping a bottle of booze for some artwork. Don't do that. Do it as professionally as possible. Use logos and colors and fonts that you can read. Make sure that the contrasts are good. Make sure that it's not high, that it is high resolution and it's not pixelated, and all of those things. And we cover that in our Train the Trainer program as well. Okay, that's it for now. Let's get straight into tonight's webinar. And by this stage, I'm sure a couple more people have come on. I just want to quickly check. Yep, we've got 15 people there. So to those of you that have just come on board, welcome. And to those that will be watching later on, enjoy the program. So we got a notification on Thursday last week that one of the directions that came from, as a result of the Disaster Management Act, this notification, or this direction, as they call it, came from the Department of Employment and Labor. And they said, the old Government Gazette is null and void. The new Government Gazette immediately takes place. And that's what we're going to be talking about. Tonight, we're going to be talking about part 2 of the COVID-19 training material. The focus then would be on the employer's part. And this is information that you can share with your clients or your employer and so forth. So I've mentioned already, we've got these 2 parts. And as of yesterday, both parts have been completely refreshed. I've Dropboxed them. They're in the Dropboxes, so you can upload them immediately. And it means that you can start running this training as quickly as you want to. So I've also added in a checklist, because I often get people saying, I don't have this and I don't have that. Well, in the Dropbox, there is a checklist of what you get. And I've numbered them to try and make them as simple as possible, starting with 1, facilitator guide, then the facilitator guide, facilitator guide cover, then the facilitator guide for part 1, and the facilitator visuals for part 1. Please note that we have facilitator visuals for part 2, but not a facilitator guide. What we have instead is we have the Gazette, and you can work from that. Then there's a learner workbook, and the learner workbook that you can print as well, version 5. There are 3 posters: the medical waste, the hygiene poster, and the compliance officer poster. That's where you write the person's name in and stick it up on the wall with the health and safety ribbon, firefighters and first aiders and so forth. Then documents 10 through to 17 are support documentation. I get a question asked of me often, this whole story of, is it accredited? Can I claim it's accredited? And well, I've just written a short letter that's in your Dropbox that talks about how this accreditation process works. But I've also written an article some time ago on CETA accreditation. So if you want that, just give us a shout, or it is on the website. Then there's an attendance list, course evaluation forms, certificates, and you'll see there's guidelines, data, and master. Very simple process. It's a mail merge system that you can use to make and create your own certificates. Then section 11 is this form with all these things on. We call it the elements. And then, of course, number 17 is the course content sheet for part 1. Because if you're making up a proposal or a brochure or something like that, you want to have the course content sheet. And I refreshed that last night. And then, of course, there is a lot of source documentation, and they form mainly government gazettes. And you'll see them from the top there: Hazardous Biological Agents, Declaration of National State of Disaster, the amendment to the government gazette, and then the TERS, the relief system, because that comes up from time to time. Then COGTER brought out their directions, and we spoke about that previously. We talk about it quite a lot, and that's Gazette number 43258. And then the new one, 43400. Sounds almost like a telephone number. And that's the one that has caused me to have a couple of sleepless nights or early mornings to rewrite this material and rewrite both, create a brand new part 2 and rewrite part 1. Okay, then you'll see there's some guidelines over there, and there's a notice of risk assessment at the bottom from the Department of Employment and Labor. Okay, so that's what you essentially get when you acquire it. I mentioned that we normally Dropbox it, and I've discovered that you've got to drop, if you have a Dropbox account, I upload a Dropbox account, and it's there. If I change anything, it's there. The changes take place in Dropbox. However, sometimes people have a little bit of a hiccup. Don't hassle, don't worry. Just call me, let me know. I have Dropbox on my phone, and I can Dropbox this from anywhere. I might be out cycling or something like that early in the morning, and I can Dropbox from the side of the road. Okay, now a very important part of any training is the disclaimer. We're not lawyers, we're not healthcare professionals. What we are is we develop as a training material, and similarly trainers, and you are trainers and consultants. So here we say to people, look, we don't know it all. And if you want to know it all, you're going to have to go to the likes of SIOSH, but you're also going to have to do your homework. And I say that to people because I get some funny questions like, why didn't you tell me that? And I go, well, it's not part of the scope. It's something completely different, but let me see if I can help you. And we do wherever possible. Okay, doke, let's get straight into it now. So on Thursday last week, we got a new government gazette. It's called the Consolidated COVID-19 Direction on Health and Safety in the Workplace. The number is 43400, 43400. And you'll see that in Dropbox, we've got this government gazette there, and you can pick it up and you can read through it and you can work with it. Except it's not the government gazette that you got directly from the government printer. What I did is I repurposed the entire PDF file into a Word for Windows document. And this is important. And what I did in the Word for Windows document is I compared it line for line, word for word with the old one. So the outgoing one, I was able to identify probably 98% of all the changes. I then highlighted the new changes in yellow. Very important. And this is going to help you with your own homework when you go back and you're going to go through it. Have a look at the yellow. If you remember the old stuff, that's great. But have a look at the yellow parts. That's the new stuff. And you'll see how I work with it in this PowerPoint as well. Then everything that has been removed from the previous government gazette is highlighted in blue. So if you're working with PowerPoints, you can change, cut, paste, and then you can use that as a reference document. And I trust that's going to help you. Alrighty. So what I'm going to do tonight or this afternoon is I'm going to just focus predominantly on the headings, except where there is a change. And I'm going to go through it quite quickly. So for instance, I'm going to just say to you, 15th of March, classification of a national disaster. I don't need to say much more because we know that. And as a trainer, you know that already. Then I normally give people a little bit of a background in terms of legislation, because once again, I find people not knowing stuff. I spoke to a young man today, and he was clueless. I was going to say something else, but he really did not know. And we know that there are three focus areas that we have to focus on in terms of COVID-19 training. That's the Occupational Health and Safety Act. People are calling it, and government is calling it OSA, like OSISI, OSA. Then the Hazardous Biological Agents Regulation, we'll come to that in a moment, and the new notices and regulations and directions that come as a result of the Disaster Management Act. So that's all I need to mention to you. There are, however, a number of other pieces of legislation which in some or other way do impact on it. But this I want to say is that it appears, certainly in terms of our database and the people that have been purchasing this training material, that standard, regular human resources people aren't buying this stuff for some reason. And yet it is fraught. Darren was talking about it pre the recording. It's fraught with problems from a human resources perspective. Where are the HR people? Please talk to the HR people and tell them that this is a really, really, really serious regulation or direction that's come out and can have some serious impact on the organization itself and on the employer. Okay, but I'm not going to get into that now. I'm not an HR expert, and there are many out there that would definitely be able to assist you. Okay, so I'm not going to talk about these gazettes, but there they are. Notice that I color it light gray. So if I personally don't feel that it's terribly important, I color it light gray so you don't focus too much attention on this one. And this is where you can switch it off if it's not relevant. So from there, I then introduce the new one. 43400 replaces 43257. What more can I say? So scrap the 43257 material, scrap everything. We're calling this version 5 and work from version 5. I repeat it again, but look at what I've done is I've highlighted the words on this PowerPoint as I did in the Government Gazette, which I repurposed word for word in yellow. On the PowerPoint that you're going to be using to actually present to your clients, there is no yellow. I've left that out so it's nice and clean. So wherever you see the yellow, you'll know this is new. Okay, I like to talk to people about the Occupational Health and Safety Act and the legislation, where it comes from and how it fits in. And those of you that have got our legal liability training program, we've got about 4 hours on the legislation and how the Act and the regulations work together, hang together, and so forth. Right at the bottom, you'll see standards and notices that normally come from the Chief Inspector. And the directions we've been seeing from the Department of Employment and Labour fall into that category. They do not have to be signed by the Minister or the President. They can be signed by a nominated person or the Chief Inspector. So this legal liability that I talk about, I've got it in 2 formats. One format is where it's PowerPoint, facilitator guide, and things like that. But I've also got it in a digital format where I recorded the entire thing. It's in a digital format, and you can then either use it to watch for yourself, or you can use it to train your own staff. Now, for COVID-19, those 4 digital recordings are free. You do not have to pay for them. And if you want them, please let me know. And Louise, if you happen to be on here with us, that's what I sent you. I sent you part 1 today of the legal liability stuff, so you can catch up on what the Occupational Health and Safety Act, or the OSHA, says. Okay, I also say to people, there are millions of employees that need to be trained. Pre-COVID Stats SA said about 16.4 million employees. Every single one of them that fall under the Occupational Health and Safety Act need training. And in this instance, need COVID training. So for those of you that are trainers out in the marketplace, it is a massive marketplace that you can work with. We also know that Section 8 of the OSHA says that the employer must inform, provide instructions, train, and supervise. And in this instance, this is the biological hazardous agents regulation that we're relating to pretty much. So this is very much part of the employer's responsibility. It then moves on, because we've now just seen inform, instruct, train, and supervise, that supervisors must be trained. Very important, because I often find that more money is spent on health and safety reps than supervisors, and the supervisors are frequently not trained to understand the hazards. So every single supervisor needs to go through COVID-19. Every supervisor needs to go through COVID-19 because it's been declared a hazard. And for that, we've got the Super Track, and that works incredibly well. It's both supervision as well as health and safety. And we've got some really good feedback as a result of that. Then the second most important section to Section 8 is Section 13, and it says the employer must inform the employee. Now, this is important because I've had questions. I had it today again, where somebody said to me, but I've got a little booklet and I've got a poster and I've got a notice and that's it. I'm going to do a talk. And I go, well, that's fine if at the end of the talk, the person you spoke to is conversant. And what does that mean? They can hold a conversation. They can talk about the subject. They can and raise an opinion on the matter. That means conversant. In other words, you talk to them, they can go back into the workplace and they can talk to their colleagues. That's what conversant means. And that's a word that's in the legislation currently. Okay, that leads us to employee induction. And if you've got new employees coming in, we need to, in fact, re-employed employees, we need to induct them as well. Alrighty, now there's one last section that I want to get into quickly, and that this hazardous biological agents regulation, because this is critical, this is vital to it. Have a look at the extract over here. It says before and after. Before and after. And this is an old regulation, dates back to 2001. It says that the employer shall adequately and comprehensively make sure that the employee is informed and trained, and in what? a whole bunch of things, and must receive instructions in writing. Wow. You know, cleaners that are going to be cleaning the place, Hazardous Biological Agents Regulation says that these people must get instructions in writing. And I'm going to read this whole one here. It says an employer shall, and every self-employed person shall, ensure that he or she, or any person who in any manner assists him or her in the carrying out or conducting of his or her business, has the necessary information and has undergone sufficient training in order for him or her to identify the potential risks and the precautions that should be taken. So when a person says, I'm going to do a toolbox talk, I go, no. The law is very specific and says the person must be trained. Okay, that then comes up again in these notices, regulations, and directions. And 43400 speaks of it very clearly. Now, I want to point out once again that they talk here of directions. So we've got regulations, obviously. We've got acts with sections, and we've got directions. Now, directions have clauses, and that's the terminology that they use. You'll also notice that 43400 has consolidated directions. So please bear that in mind. Okay, here's the index to 43400. I've highlighted the three primary areas which you do need to pay attention in the sense of your own research and understanding, and we'll get into it. So those clauses go from 01 to 64. The numbers have all changed from the previous one. They just use a new numbering system for this one, which might be a bit confusing in the initial stages if you started remembering the numbers, which I try to do, but they've changed those numbers. So the ones that you're going to be focusing on is the reopening of workplaces, symptoms and screening, and you'll see that there are sections of not all of it, some of it is new, and then 48 to 56. That's the human resources nightmare. No, maybe I shouldn't use the word nightmare. It's probably not the right word because it can be managed. And we will get into that. Okay, so from here onwards, we know everybody's got part one. I'm not going to be talking about it tonight, but that has completely been refreshed with all 43400 information in it. Okay, then it starts off, 43400 starts off by saying that Department of Employment and Labor appeal to employers to use OSA and the HBA regs. So there we go, it's repeated over there. Then in the preamble, it talks about protecting people, and it then introduces this concept of being permitted to commence operations. Remember, up to now, it's been lockdown, lockdown, lockdown. You weren't allowed to do anything, go anywhere. You had to stay at home and smoke your own home-rolled cigarettes. But now they are talking about, and as we know, level 3, they're talking about permitting people to commence operations. Then in the preamble, it says that the employer must take reasonable steps. Introduces the concept once again, I'm sure you're all familiar with it, of reasonably practicable. I've highlighted the number 5 for the good reason, simply because these numbers are changing. Then in the preamble, it talks about protecting others, talks about the identifiable hazards, and changes the word that was previously there from directive to direction. Hope that makes sense. I like to talk to people about what are these things, dangers, hazards, and risks, and I just take the definition straight from OSA of a danger, a hazard, where it says a source of or exposure to a danger. And then it talks of risk. And you're going to see that we talk about these two things, hazards and risks, in 43400, where they talk about the virus is a hazard and you must do a risk assessment. Okay, now again, we have higher training material that's available. If you haven't done it yet, do it. If you can run it for your clients, do that as well. You can start adding quite a nice flavor to your training that you're doing. And I said to somebody this morning, or yesterday, I said, COVID is like kindling. If you want to start a fire, in as much as your marketing drive, your business, the growth of your business, getting back into the trenches and things like that, use the kindling, use COVID, because there's just such a massive need. And then you can build on top of that. Okay, then in the preamble, it talks about the risk assessments, and we'll see a little later that they give us some more detail on that. It talks about mitigation and elimination. Okay, all I want to point out over here is, in the preamble, it also talks about that sector-specific measures may need to be written, and there will be sector guidelines that may appear. We haven't seen them yet. We'll see them later on. It's moved from Annexure A to Annexure B. It's right at the end of the legislation, and we'll get to that. Okay, so here we go. Every piece of legislation starts off with definitions and explanations, and I say do not assume that you know what this word means. The word employee is defined in 4 different pieces of legislation in 4 different ways in our country. So one definition does not necessarily apply to another definition. I've often heard of people talking about competency and they say all employees must be competent. No, competency relates to CETA accreditation. If it's not a CETA requirement, competency does not relate, but don't use the word willy-nilly. What they have now defined is an inspector, who that person may be. They've defined what regulations are, and we now understand what they are. And they are regulations that are written, might be under another act, but in terms of the Disaster Management Act. Then they've introduced a new definition called vulnerable employee. So you can read it yourself. I'm 66 years old, and that means I'm a vulnerable employee. And if I was employed by an employer, then obviously that employer is going to have to treat me with special kid gloves and not allow me to come to work and make me work from home, which really, I love it. I enjoy working from home. Okay, so vulnerable employee means an employee, as contemplated by the Department of Health guidelines, as somebody with known or disclosed health issues or comorbidities or any other condition that may place the employee at a high risk of complication of death, other than employees if infected with COVID-19. Now, when I read the legislation, what I do is I try and break it up, because I have these long convoluted sentences full of legalese, and I try to punctuate it myself or create bullet points. Sometimes I still don't understand it, but there we go. Now, if you want to understand it, there are people, and certainly Saosh has got an attorney, an advocate, who will then interpret it for you if you need that interpretation. Please use that facility, it's free, and Advocate Luch will answer your queries if they have not been answered before, and then it's just a matter of going to search for it and finding what the answer might be. Alrighty. Now, remember we spoke about being permitted to work and being permitted to continue working and to commence operations. So this is where in clause 13, they've now added in permitted to continue or commence operations under the regulations. Not a major one, we're pretty much familiar with that. But previously, they used to talk about being permitted to work, and you'd have to get a permit, the essential or essential services permit that we used to get from CIPC. And we got one, and now it's null and void. So it's now just a bit of historical documentation. You do not need it anymore. Those of you that have it, it's useful, and I believe that they've stopped issuing them on the website. Okay, then we talk about, or they talk about, who this applies to. Well, if you know the Occupational Health and Safety Act, there are certain exemptions and exclusions there, so it doesn't apply to them. And who does it apply to? Well, it definitely applies to those who have less than 10 employees. Now, here's an area that I have a great disconnect with. Who determines 10 or more, 10 or less? And you're going to see that the number is 10 or more, or 11 or more, up to 500. And we'll come to that in a moment, but it's confusing. I don't know why, if you've got 11, you've got to do something, and if you've got 10 or less, you've got to do something else. Well, there we go. It is what it is. And the clause number used to be clause 40, it's now clause 46. As far as the period is concerned, we know that there's no date that's attached to it other than the start. We're still all hoping for a finish that is reasonable, and we can get back to work as normal. Okay, so here is where we start. Clause 17 is new. And I'm going to go through this. I'm going to read it. Excuse me reading it. I'm sure you can read it yourself, just so we can highlight some of these things here. It says, as and when any regulation made in terms of Section 27 of the Disaster Management Act permits industries, businesses, entities, both private and in the public sector, to commence operating. Every employer commencing operations must. Every employer must undertake a risk assessment in terms of clause 20. And it says, on the basis of that risk assessment, every employer must develop a plan outlining the protective measures. Every employer must consult. Now, that's an interesting one. And those of you, once again, that are familiar with the health and safety RIP system in terms of OSA, you know that consultation is a very important part here. But that's a question which I have, and I go, well, okay, we're going to consult with these people. Well, what do these people know about this issue? Well, at this stage, pretty much nothing. However, once you've done the training, then of course they know something about it. And to me, that's kind of like a license to train. Every employer must, and it says consult. Okay, who should we consult with? And who should we be selling this training to? Trade unions and the representatives, health and safety committees and representatives, very important. And it says where there isn't a health and safety committee, then it says there, let's quickly read it. Any health and safety committee established in terms of section 19 of OSA, or in the absence of such a committee, a health and safety representative, there we go. And then this plan that we've been consulting on must be made available to the inspector and a person contemplated in 17.3. So what was 17.3? That was 17.3. Anybody in those sections? Okay. And you know that health and safety rep training is going to have to change as well. So all of that's going to have to be rewritten or at least modified, and I'll be doing that progressively. Then clause 18 says, now this plan that we're referring to must include the dates and times and opening hours, the list of employees permitted to work or to return to work at least, and or are required to work from home. So remember the vulnerable employee, you've got to have a list of all the vulnerable employees that are coming to work and all the vulnerable employees that are not coming to work. And remember that some vulnerable employees will have to go to work because they are maybe directors and shareholders or something, not shareholders, but directors in the company or senior managers. Then there is a timetable, and the likes of Darren and the guys have been following this very, very closely. There it talks about the vulnerable employees in 18.4, and it says we're going to reopen the workplace. We must minimize the number of workers at the workplace. Now that, gosh, that's something that I wouldn't want to do if I have a production operation and I've got to gear up to full production. Tough on that. 18 carries on. It says must include the workplace protective measures. So I've been saying to so many health and safety people, this is our time. This is your time to shine. This is where you're going to step up to the mark and you're going to help write these things and establish them and collate them and maybe even enforce them. And then it carries on. It says to required to be taken in terms of this direction and any sectoral guideline. Remember I spoke about Annexure B, any sectoral guideline to get the workplace ready. And then it carries on, must include the measures for daily screening, which we kind of know about, most of us know about. Those that are only opening up now, like the schools, daily screening was a new thing for them. And of course, the details of the compliance officer. Now, previously they spoke about a manager, but now they're calling that manager the compliance officer. And then the employer contemplated in clause 17 must phase the return of the employees to work according to the plan. So we understand that. Okay. Now, moving on, we talk about the risk assessment. And I said there's this peculiar thing about numbers. It's like first aid. If you have less than 10, you don't have to train anybody, which is strange, suggesting that nobody gets injured in a company where there's less than 10. And then it goes from 10 to 50 and 50 and above, and we know that story. And of course, the General Safety Regulation 3, it's been discussed that it's going to be completely rewritten in the near future, and we hope to have a part to play in that. So I can't answer you exactly why they have these number systems there, but they are what they are. Then it carries on, and now it talks about vulnerable employees, and it says they must submit a record of the risk assessment to the Health and Safety Committee. I think previously I mentioned this as one of the questions that comes up is, but if we don't have a quorum for the Health and Safety Committee because we're only working with 1/3 of our employees, how do we get the Health and Safety Committee to actually agree upon something? Well, that's a human resources thing. You're going to have to obviously be reasonably practicable about that. And now they put a date to it when this risk assessment must be submitted to the Department of Employment and Labor. And guess what? The Department of Employment and Labor are going to sit with about probably 1 million of these risk assessments. So why they even had that in place, I have no idea. Crazy, but gosh, how it's going to be administered, we don't know. And we don't know whether this is digital or it's in the physical hard copy that's going to be delivered at the door. Wow, that's uncertain to me, but it is something that I'm conscious of and familiar with. Okay, then it talks about submit a record of its risk assessment together with the written policy concerning the protection of the health and safety employees from COVID as contemplated in Section 7 of the OHASA. And I think Section 7, if I'm not mistaken, was health and safety policies. We're still talking about the vulnerable employee, and then we move on from there. This is where it talks about notifying. Now, remember earlier on, I spoke about Section 13 of the Act informing employees of the hazards that they're going to be working with, and Section 8, inform, instruct, and train. So the young lady that I was speaking to this morning, she was saying that she has a client who says they don't believe that they need to do any training. Well, if it's not training, how are they going to learn the contents of this direction, 43400? How are they going to learn what the other pieces of legislation that relate to them talk about? So obviously, this is about notifying people, and obviously it's a process of training, educating, informing, creating awareness, and then it says that it must notify its employees that if they're sick or have symptoms associated with COVID, they mustn't come to work and they must take paid sick leave. Okay, so straightforward. That's now in part 1 as well. Then it carries on and it talks about this compliance officer, and it says the employer. When it says it is the employer. And you probably know that it isn't a person. It is an entity, a PTY, a trust, a CC, a government department. That's the entity. The employer is the entity, and the CEO is the guy who carries the can, guy or woman who carries the can. So the employer must appoint a manager. Now, is it a full-time manager? Is it a part-time manager? Is it one of the own staff managers? Who's this manager? Is it a safety manager, an occupational health nurse? Who's this compliance officer that we're going to be appointing? Another nice question to discuss over there. And these are some of the duties or functions of the employer, compliance officer: to oversee the implementation and oversee the adherence. So in other words, this person actually has authority to probably stop work, to discipline people, to correct them, to take them to task. It's a human resources issue here. And this compliance officer's job description is going to have to be very specific as to what they can and can't do. Okay, it says oversee the adherence to the health and safety measures established, to give effect to the requirements of this direction, regarding and including the appointing of employees to perform this function if the employer has more than one workplace. The way I read that is more than one compliance officer. Who would they be? We don't know. This is a discussion, and obviously it's something that you'd go through with your employer or the client as to who they're going to appoint and what those people's qualifications are. Okay, once again, it talks about monitoring. So is the compliance officer a supervisor? And we can see here that supervision comes up once again. Monitoring and supervision comes up once again. Part of my, my battle cry is to get supervisors trained in occupational health and safety as quickly as possible and as effectively as possible. It then carries on and talks about minimizing contact. Well, we know about that. We've dealt with that previously. But please notice that minimizing contact now is the limitation or limiting of congestion in public transport. So in other words, you would then be releasing your employees in groups so that they don't go and fill the bus. I don't know how that's going to work. Interesting one. Hopefully we'll get some direction on that one. And it says limiting congestion in public transport and at the workplace. So it's tea times, lunch times, starting times, things of that nature. Carries on and it says must inform. Notice this word inform, 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 inform. Comes up again and again and again. And it says here, and remember the word conversant. Section 13 said the employee must be conversant with the hazards. And here it says that the employer must provide workers with information that raises awareness in any form or manner, including, where reasonably practicable, leaflets and notices and posters and banners and announcements and things like that. And these must be placed in conspicuous places in the workplace, informing workers of the dangers and the manner of transmission and the measures to prevent transmission and. So one of our clients has taken some of this training material and turned it into a video, and they've actually got a video that's running perpetually, a fairly short video if I understand, it's probably about 10 minutes, 15 minutes, running perpetually. It just loops over and over and over and over and over, and I'm not sure where they've got them positioned, but there we go. Now I've provided in the pack, I provided 3 posters, and folks, these posters were made on PowerPoint. You can make your own posters. You don't have to go and buy an expensive poster, although there are some beautiful posters that are available that you can just buy and use and distribute. But making a poster of this nature is really cool. If you happen to be a service provider and you now you're selling your services, I invite you to customize it and put your email address on there and your website address and things like that. So as far as we're concerned, this is something that you can do by all means with our blessing. Okay, then once this person has been diagnosed, obviously we're going to be talking about the investigation. And we've spoken about that in the past. And I'm sure you all know that we've got this program called the Invest Track. And once we've done the investigation, then the employer is to determine the need to temporarily close the affected work area. So let's go back. It says, just have a look at 20.11.2. So they're asking, how was this person exposed? Where were they exposed? Why were they exposed? Because it may very well not be in the workplace. It could be on the way to, on the way from, at a funeral, at church, at a gathering, in the mall, or someplace like that. And the investigation needs to take place. Those of you that have been in the health and safety world know this. Wow. I've seen some investigations that are atrocious. I could have given this to my grade 4 son when he was in that grade and said, investigate. And that's about the level of the investigation. And I've seen things like, and I've heard things where people say, we're not here to find fault. We're here to find the facts. And the truth of the matter is, this is criminal legislation. How can you not find fault if somebody's at fault? Remember, it's criminal. This isn't just an advisory thing. Criminal legislation requires that we find fault. Who's guilty? Who was the perpetrator? Why did this happen? And as an ex-policeman, I feel strongly about that, because health and safety frequently we go, oh, let's feel bad for the person. Yeah, feel bad for them, that's fine. Especially feel bad for the family if the person's passed away. But we're here to find fault. What's wrong with our system? And please notice, it says investigate the mode of exposure, including any control failure. We don't want to find the facts, we want to find fault. What went wrong? If you're an aircraft engineer, and I'm not sure if Daryl's on the program with us, he was an aircraft mechanic. Aircraft mechanics are paid big bucks to find fault, not to be positive. Oh, we'll believe it'll fly. I believe I can fly. We're here to find fault. That's our game. That's our job. That's what we do. Because from that, we can find what's wrong with the system. Symptoms lead us to systems, and we can see whether it works or not. And that works in medical science as well. Okay, now once we've found out what the faults were and what the facts are, we can then decide, are we going to close this workplace or not? And we'd obviously be closing it for whatever reason, and we'd be doing this based on this incident-based risk assessment. So HIRA, hazard identification and risk assessment, where we're looking at frequency and severity and probability and things like that. That'll help us determine whether or not we're going to have to close this workplace. Now, this has a massive impact once again on an employer. They've been closed for the last 2 months. Now they start up and now there's an incident. Now we investigate. Now we have to close down again. And this could be the demise of many, many companies. Okay, temporary could be a day or it could be a month. We don't know. And then how do we know that we're ready to go back to work? That's got to be in the policy that you're going to be doing as well. Okay, from there, then we go and have a look at social distancing. We're all familiar with that, and they're talking about 1.5 meters, and that's in South African legislation. And they do say now, and they've changed the word to greater, where the minimum distance may need to be greater. And that's obviously a management decision and call that one would do there. Social distancing carries on, and I want to just quickly point out that when we're talking about social distancing, obviously we also know about the physical barriers. And wherever I go, and that happens to be here, and I'm sure that's exactly the same where you live, is that they put up these perspex barriers and yet the people sit and talk around the side of the barrier. So Penny and I went off, it's her birthday soon, and I bought her a birthday present, and I was paying for the birthday present. There was this barrier between the lady and myself, and I found myself talking around the barrier so I could be heard and she could hear me. Crazy. But watch this. It says, arrange physical barriers to be placed between workstations or erected on workstations to form a solid physical barrier, or, when required, supply the employee free of charge with the appropriate PPE. So everybody that has gone and paid a huge amount for the physical barriers could have just gone or supply the employee free of charge with the appropriate PPE. Interesting one. However, I have friends that are probably in the shop fitment industry that have made a killing out of all these barriers. And well done. I'm an entrepreneur and a capitalist, so I'm good with that. Okay, then notice we're talking about social distancing. I want to once again point out supervision. I think I've mentioned it 3 or 4 times already. Supervision, 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 supervision. And a supervisor is supposed to be a supervisor, not just a person who casually walks around having a look. And it talks about what we should be doing. Okay, let's go back to our index. So far we've been talking about clauses 1 through to 23. Now, let's carry on and we have a look at 24, symptom screening. What they've done here is they've added 1 or 2 words and they've shuffled some symptom words around. So I've highlighted loss of smell or taste. It was actually in another clause. They brought it into this one, so no big deal. No major changes there. No major changes there. They've added in COVID-related symptoms. That's about it. The rest of it stays exactly the same. But they introduce this. Undertake contact training. Now, I've got no opinion other than my own, so please check this one out. And if you've got an opinion on it, please give it to me. So in other words, now, the worker presents symptoms. The employer must assess the risk of transmission and disinfect the work area and the workstation. Great, that's fine. And undertake contact tracing. Where? When? Who? How? Is this work-based contact tracing? Is it socially based contact tracing? Must we find out who was in the car, bus, or train with the person? Must we go back to their church, their funeral, their household, their bride that they had over the weekend? It doesn't say. It doesn't say. It just says, undertake contact tracing. So Joe Bloggs presents symptoms, and now I've got to go and track this guy for the last 14 days. Is that what it's saying? And isn't this a Department of Health issue? I don't know. I don't want to raise an opinion on it. All I want you to think about it, please. Okay, symptom screening continues. It talks about what we should be doing in terms of the Basic Conditions of Employment Act and obviously the Employment Equity Act. So these are human resources issues. These are labor relations issues, which I tell people all the time, I really don't know much. I've attended a 1 or 2 day workshop on it, and that was 100 years ago. So I don't even know what's up there with us. But what I do know more about is if a claim has to be submitted because this COVID virus is now regarded or was regarded as workplace-based, then there is a whole COIDA, Compensation of Occupational Injuries and Diseases Act process, and we need to follow that. Once again, you probably don't have to do it, but you should through your human resources person. Alrighty, now this worker comes back, and it says here, these are inclusions. The worker has completed the mandatory 14-day self-isolation. Question, where do we mandate that? Okay, then it talks about the worker has undergone a medical evaluation. Well, that's not a first aider, that's not the security manager, that's not the safety manager. That is a medical practitioner, and generally it would be an occupational medicine practitioner, where they talk about medical surveillance and things like that. But a medical evaluation confirming fitness to work if the worker had moderate or severe illnesses. So there's a whole issue around whose doctor are they going to go to, who's going to pay for it, all of those sorts of things. Is this a compensation of injury and diseases issue and payment and so forth? Okay, then it carries on, and this worker is now returned, and it says that this worker must wear a surgical mask for 21 days from the date of diagnosis. And I go, well, he was diagnosed a week ago and he was in quarantine or in self-isolation. It's vague. But nevertheless, our job is to inform the employer, and then the employer needs to get some additional information on it. Now, this is where it really does start picking up here. It says here, if a worker has been in contact in the workplace with other workers who have been diagnosed with COVID-19, the employer must assess that worker's exposure. Obviously, that's done through somebody that is competent and capable, an occupational health nurse, occupational medicine practitioner, a general practitioner, or someone like that, in accordance with Department of Health's guidelines. And I've got some guidelines in the COVID-19 pack, which I'm sure you would have had a look at by now, and then ascertain whether the exposure carries a high or low risk of transmission between the workers. Back to HIRA, hazard identification and risk assessment. All right, it says if there's a low risk of exposure, the employer may permit the worker to continue working using a cloth mask, complying with standard precautions, and monitor the worker's symptoms. So that compliance officer is going to have quite a busy day, 14 days from first contact. If there's a high risk of exposure, the worker must remain in quarantine for 14 days. So I said, where do they declare that? This is where they declare it. And the employer of that worker must place the worker on sick leave. So now obviously there's additional costs and claims and things of that nature. Now we get to sanitizers. I think we've spoken about that, and there's now discussion as to sanitization through the fogging system where people walk through it, and that could be dangerous. And I saw something from the Department of Health that said that isn't recommended. However, please get your own information on that. I'm not including that at this stage because we don't have anything hard and fast in writing that I know of yet. It talks about sanitizers and disinfectants. Okay, so let me just quickly go back to disinfectants. Many of those disinfectants are hazardous chemical substances, and I mentioned to you earlier on that there is a hazardous chemical substance regulation, and we've got a program called the HazChem when it comes to chemical substances and the treatment thereof, and not treatment, the use thereof, and so forth. Okay, blah, 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 blah. It talks about regular cleaning and disinfection. So maybe at this stage I want to say that in part one, one of our clients, very clever, they actually had a practical exercise where they had all the equipment necessary, all the personal protective equipment, all the cleaning equipment, and they actually cleaned like a kitchen or a bathroom or something like that. The learners doffed and donned, and they went in, cleaned, well, they doffed, and then they took the stuff off afterwards. And that was the practical. They had to clean it in front of the trainer or facilitator. I thought it was a pretty good idea that maybe that's something you can build into your program. Okay, this continues, not much changes there. Cloth masks, and they're now highlighting what we've been saying all along, and we said this in part one, that some people may not have it, and other people may not know that they have it. It's as simple as that. And then it says all persons wear cloth masks when in a public place. So important. I've been walking around the mall in a mask, and it is very uncomfortable in a more formal mask. But the cloth mask is quite comfortable to wear, and you can breathe through it. Okay, just reference back to the part one. Cloth masks, and they talk about Department of Health's recommendations. There are recommendations. I do believe that they are in the pack as well. If not, you can just get that off the Department of Health's website. Cloth mask, cloth mask, cloth mask. Here's a change. This is actually an extract from Section 8 of the OSA, and it was just a typographical error in the previous regulation. It said informed, trained, instructed, and instructed. And they got that word supervised, lost that. Now they're talking about specific personal protective equipment when we're talking about cloth masks. It says where the risk assessment indicates that specific personal protective equipment, not just PPE. Interesting, they've just changed the terminology, made that a little clearer. That section of clause 42 stays the same, measures in respect of workplaces to which the public have access. And what they've done here now is they've added to that, and they talk about the floor area, working on how many people can actually go into the workplace. The question was, and it's a valid question, how many people am I allowed in my workplace? You know, I've got my social distancing, I've got my barriers, I've got my lines on the floor, I've got shields and or curtains and things like that. And they're saying now there is a bit of a, not a formula, but there is a way of determining who may be in that workplace. So that's going to have to come up in the policies and procedures and standards. There might have to be signs and notices saying that this room can only accommodate 16 or something of that nature. Great, carries on. They talk about these physical barriers, or we've spoken about that already. Carries on, no changes, no changes, no changes. Ventilation, no changes. Small businesses, less than 10. This is a bit of a repeat, which is interesting. I'm not sure who is writing this, but maybe they just felt it was important. And these are the florists and the hairdressers and people like that, small businesses. And certainly small businesses such as training companies where you've got less than 10 employees. That's important. And it says that there's similar things, barriers and social distancing and things of that nature. Continues the small businesses, and there's not much more to add over there. But here, and this is going to be the last major section that I deal with over here, is 48. This, to me, has to be explained to me. Really has to be explained to me. So please consider this, go through it, read it, contemplate it, just really apply your mind to this. It says employee may refuse to perform work. Any work. If circumstances arise which, with reasonable justification, whose justification? Who's going to determine? The employee? Well, it says justification appear to that employee. Now, the employee has probably not got much by way of background or understanding. It says appear to that employee. So the employee says, it appears to me that I'm being exposed. Goodbye. Walks out and demands a salary for the time that they're out. Or it appears to the health and safety representative. And folks, with huge respect, I love these health and safety reps, but they're just generally eyes and ears in the workplace, and they have no more than a day's training. So an employee and or a health and safety representative can now decide, that's it. There is an imminent and serious risk. It doesn't reference back to the risk assessment or the hirer or the manager. It then says, this employee must notify the employer, that's understandable, either personally or through the health and safety rep. So as he's walking out, he says to the health and safety rep, I'm leaving, and I think that we're exposed. Goodbye. Okay, Darren, you and I can have a long discussion on this one, and those of you that are familiar with the labor relations legislation will know that this is a major problem. Now, when one person walks out, I'm leaving, everybody else is going to go, hell no, I'm not staying. And you see the problem. And that's maybe me and my overactive imagination. But if one person says, I'm leaving because there's COVID in this workplace, you could depopulate that business in minutes. This is going to have to be reviewed in some other way. So having said that, please consider it. And then it says every employer must, after consultation, so everybody's walked out, or the department's walked out. Then the employer gets together with a compliance officer who was not involved in this original decision, and any health and safety committee, which may or may not be constituted yet or reconstituted because they've been away, endeavor to resolve any issue that may arise from the exercise of the rights in clause 48. The people are on the pavement. Now the compliance officer must go out there and he must start negotiating with the people to resolve the issue. This is a nightmare. I don't want to even be an employer at this stage. Okay. Then it carries on. Clause 48 applies whether or not, listen to this, whether or not the person refusing to work has used or exhausted any other applicable external or internal procedures. So in other words, you don't have to go to the committee and say, I'm concerned. You don't have to go to the compliance officer and say, I'm concerned. You don't have to go to the employer and say, I'm concerned. Whether or not the person had used or exhausted, you don't even have to go to your trade union and say, I'm concerned. Just walk out. Okay, so leave that one there. Then it says, no person may, now that's the compliance officer or the employer or the supervisor, advantage or promise to advantage any person for not exercising his or her rights in terms of clause 48. Wow. Okay. Then the employer may not make, so everybody walks out and you must pay the people because they walked out. May not make any deduction from any employee's remuneration or require or permit any employee to make a payment. Okay. So please, as you go through this, consider this, talk to your attorney, talk to your labor relations practitioners that you have here. And then, of course, I understand this, you may not threaten them, but it also says you may not dismiss them or discipline them or prejudice them or harass them for refusing to walk out. So in the worst case scenario, Joe says, I'm leaving, says to the health and safety rep, tell the employer I'm leaving because there's COVID in the workplace, and I believe because that guy's sneezing and coughing, and I'm going, goodbye. The rest of the department pick up their suitcases and handbags or backpacks and walk out. Now the compliance officer is standing on the pavement trying to get the people back in. The employer's going, what the heck's going on here? The machinery is running in the background and nobody shut down the plant. Do you understand the situation? Okay, so from Ken to you, let's get some information on that. I don't have it. Alrighty, let's move on. And now it's talking about monitoring and enforcing. Of course, this is by the inspector in the Department of Labor, Employment and Labor. And we spoke about these sector guidelines. And it says another interesting one, it's talking about Annexure A. Annexure A is somewhat different. It used to be Annexure A where it was the sectoral guidelines. Now it is a list of websites. And it says, the minister may from time to time amend Annexure A and publish it online without issuing an amended direction in order to update the links. So if anybody hears of any changes that the minister has made that's been published online, please notify us, and we've got a nice notification group here, and we'll notify them. Okay, let's end off now by talking about these sector-specific guidelines. Annexure A, we said, were all the websites. Now, folks, I'm not even making an apology over here. I'm just going, hell no. In the Government Gazette, none of those links work. And I have sat for hours. No, I've sat for an hour trying to find those links. If you can get those links to work, please pass them back to me. I don't know what they've done, but you can't actually access those websites. And the websites are supposed to talk about guidance on vulnerable employees and workplace accommodation, guidance notes for workplaces in the identification of COVID-19 positive employee, clinical management of suspected or confirmed cases, guidelines for symptom monitoring and management of essential workers, and then how to use a cloth mask. I can't get one of those URLs to work. Help me out if you can, please, and then I'll just update that page as well. Then finally, Annexure B is the sectoral guidelines, and I'm just going to read the headings, the workplace risk assessment. Now, they've taken out 2 elements out of that one. I remember when you go through the government gazette that I repurposed with the color, the yellow with the inclusions and the blue with the exclusions, have a look at that. That stays the same: engineering controls, administrative controls. I'm just merely highlighting the fact that we might see a sectoral guideline for education and training, giving us more clarity on it as to what should be dealt with, but we've not seen that yet. Health and safety work practices, provision of safe transport for employees. And the last thing I want to say to you is that there's a ton of information on the SAOS website that you can go and access. You know, at the end of this session, this whole COVID-19 thing, when the dust settles, what we're going to be able to do is go back into the workplace and claim our place as professionals. People who know what they're talking about generally, and if you don't, get to know it. People who have some sort of authority or qualification, some experience that you can go back into the workplace. I say, this is our time. This is like probably the best thing that could happen to a health and safety practitioner or trainer. Because now if you say to a person, wear PPE, he or she has been educated by the world media to wear PPE. If you say social distancing, they'll understand that. If you say take the precautions, they'll understand it. If you say wash your hands on a regular basis, they'll understand it. If you say to the person, if you're sick, don't come to work, they'll understand it. Penny and I have been talking about the fact that we will never ever fly again without a mask. Because about 4 or 5 months ago, I flew back from South Africa and landed up in hospital with a lung infection because of a guy sitting behind me who was snorting and coughing and sneezing. From now on, I'm going to wear the mask. It's just going to be my thing when in that kind of confined environment. This is also a wonderful opportunity for you to revive your company health and safety program, or if you're a consultant, their health and safety program. I trust that through this entire process, you've learned about Zoom, and you've learned about Teachable, and you've learned about how to make your own videos, and you've learned about what works and what doesn't work. I trust that you've learned things like accreditation, certification, endorsement, registration through some of the sessions that we've had, and certainly on our starter page. I trust that your own ability to teach people and how to how you do risk assessments have changed, and that you've grown as a result of this process. I trust that your writing skills have improved, your public speaking skills have improved. I trust that your confidence as a safety practitioner has grown by leaps and bounds, because now we're dealing with employers who are very, very conscious. And I think you'll all agree that employers normally go, yeah, as far as COVID-19, as far as health and safety is concerned. But now they cannot move without being pummeled with the COVID-19 message. I'm sure you also know that there's facts and fiction, and there's myths, and there is misinformation that's come out as a result of this. But now I'm sure that you are conscious of, look at the stuff that is reasonable and understandable. Our job is to translate the law and share the principles. Our job, when it comes to standing in front of a group of people, whether it's on Zoom or it is live face-to-face, is not to give our opinions. Our job is to cause them to think and to consider and to rethink and to debate. That's our job. And I want to say to everybody that's been participating in these COVID-19 workshops and webinars, thank you for participating. I really appreciate it. I've enjoyed them thoroughly. We will continue next week, but not necessarily with the focus on COVID-19 unless something else happens. And I'm hoping that that's kind of the end of the development of this material. Now it's a question, it's over to you. And over to you means that you can decide what you're going to do, how you're going to do it, what the appropriate tools are that you're going to use. It's up to you now, and I'm very happy to consult with you if you need some information and guidance on it. But for those of you that are consultants and trainers and service providers, I trust one of the things that you're learning to do is to market, how to use Facebook, how to use MailChimp, how to use HubSpot, how to use LinkedIn, how to use Google My Business. I trust that you're starting to use these platforms so that you can get the message out there, not just the COVID message, but also the message of your company. And I've told many, many people, and I'll mention it again, my daughter's got a degree, a bachelor's degree in media, and she and her boyfriend, this is what they do. They actually help people professionally to get their marketing in place and get the traction that your company needs so you can get back to work. I do know that some of you have taken a lot of strain as a result of COVID-19 from a financial point of view, and I want to urge you, this is the firewood. COVID-19 is the firewood to rekindle your business, to get your business up and running. So I'm going to just say, once again, if you've registered and you haven't, if you've logged on and you haven't registered, please just register via WhatsApp. You can use my number at the top there, but there's Penny's number as well. Quickly grab your phone, take a photograph of that screen so that you can contact either Penny or myself. And if you have any challenges, please talk to us. Sometimes I can and can't answer. Please understand that it's become really busy on our side over here, but it's been an absolute privilege and I've thoroughly enjoyed this process. And I'm going to switch off the recording in a short while, but I just want to ask you once again, tell us what you think. Go onto our Facebook page and either like or review. Go onto our Google My Business page. Let us know. Send us your information that we can just share this message with as many people as possible. We now have dozens and dozens and dozens of individuals that are making money from COVID-19 training. And as I said to the caller this morning, I said to her, in the past we used to make money from health and safety reps, from HIRA and investigation and firefighting and first aid training. This is just another topic that we've got now. So don't feel guilty that you're making money, but please let us know what you think. It's been wonderful working with you guys. And I really believe that we can and have made a difference through this program. And I'm going to start now by just saying, tell us and tell the world. Tell the world that you are able to provide this service to them. For some of you, it's not just training, but it's also consulting. Tell the world that you're out there. Tell them who you are. Be professional about it. Get your accreditation with CETA if you need that. Talk to us about that. Get your accreditation with SIOSH. Talk to us about that. And then literally, it's a question of, we're going to wish you everything of the best for the future as far as COVID-19 is concerned. And from Penny and me, we just want to say, remember always, if you don't train them, you can't blame them. From Ken here in Mauritius, thank you very much on this session. I'm going to stop the recording now.